Good morning, everybody. Welcome to the first Education and Health Subcommittee on Health Professions since crossover. We have a pretty short docket, and I'm just going to roll through these. Delegate Hodges, if you'd like to come up and present HB 1067, I'm happy to hear your bill.
Well, thank you, Madam Chair, members of the committee. HB 1067 deals with the expansion of duties for pharmacy technicians. This goes back to a work group from legislation in 2020, looking at making recommendation for additional duties and tasks that pharmacy technicians may perform. The report, when it came out, was to allow pharmacy technicians to clarify with the prescriber or prescriber's agent the quantity and number of refills intended for a Schedule 6 medication. When you look at Schedule 6 medications, these are non-controlled medications, typically for diabetes, hypertension, and so forth. And I can tell you, and as a pharmacist working in a pharmacy, how many times this happens. It's fairly simple tasks that can alleviate quite a bit of time for the pharmacist and working on the counter, which can be very stressful in today's world, because currently pharmacists may only perform these tasks. It also allows for the transfer of a Schedule 6 prescription, except for an on-hold prescription by the pharmacy technician when you have a shared platform to be able to do that. So fairly simple tasks that can help with workflow, and you've all been to the pharmacies and seen the chaos that's going on, so anything we can help with workflow and to decrease the burden. So that's the bill, Madam Chair.
Thank you. Are there questions from the members? Yes, if you have a motion, we would entertain it.
Thank you, Madam Chair.
Second.
All righty. We have a motion in front of us. If the clerk would open the roll.
Senator Pekarsky?
Yes.
Senator Head?
Yes.
Senator Bagby?
Yes.
Senator Pillion? Senator Boysko?
Yes,
Ayes 4, no 0.
your bill is recommended for reporting, and see you at the full committee.
Thank you, Madam
Thank you.
Chair.
All right, I know that Delegate Price has to chair a committee quickly, so let's get you in front of us. You've got HB 605. Please tell us about it.
Yes, so right now, Madam Chair and committee members, after a dental hygienist has seen a patient that is under remote supervision, they have to have an examination within 90 days. And we were finding that with some of the dentists and their busy patient loads, that it was really hard for them to get into that time frame. And these are hygienists that are seeing patients in our free clinics, elder care, things of that sort. So this would move it to 180 days to give them more time to be able to work them into the patient load.
Madam Chair,
Yes, Senator Bagby.
anyone here to speak in opposition? Move the report.
Second. Clerk, if you call the roll.
Senator Pekarsky? Senator Head? Senator Bagby? Senator Pillion? Senator Boysko?
Aye.
Ayes 4, no 0.
Thank you, Senators.
Thank you. Okay, Delegate Maldonado, you have 699. Tell us about your bill.
Thank you. Good morning, Madam Chair, members of the committee. I think I tried to speak with all of you about this bill. It is a simple bill. There's peace in the valley, which I always love to start with. And this bill was inspired by a desire to try and address our opioid epidemic at the front end and not just once somebody is in the cycle of abuse and addiction. So what this bill does is it requires prescribers, medical practitioners, when they want to dispense an opioid, they have to tell the patient or the parent guardian of the patient that it's an opioid, that it has addictive qualities, why they're prescribing it, and what the alternatives may be. It has the standard exemptions for people dealing with serious illnesses like sickle cell and end of life, but essentially it is to help with the medical counseling. This bill has passed in 20 other states. It was first passed in New Jersey, and since then the research has shown that in New Jersey in particular, the rate of prescriptions have gone down, the rate of addiction has gone down, and the rate of filling the actual prescriptions has gone down.
Thank you so much. Are there people, Senator Pillion, did you have a question?
Just a comment and a question. So your bill is great. And it just requires documentation in the chart
That's correct.
Correct, that's it. Just
Yes,
that
that's
you've
correct.
gone the 3 points over with your patient, that's all, right?
Madam Chair, I would say to the Senator, yes, that is correct. And that documentation editing was at the suggestion of MSV, and that was their contribution as we all kind of came to the same place on the bill.
Thank you. Are there people in support of the bill, people in opposition? Seeing none.
Report.
All righty, we have a motion and a second. Please call the roll.
Senator Pekarsky? Yes. Senator Head?
Yes.
Senator Bagby?
Yes.
Senator Pillion?
Yes.
Senator Boysko?
Yes.
Ayes 5, no 0.
Delegate Maldonado, we will see you in full committee. Thank you.
Thank you, Madam Chair. Members of the committee.
Absolutely. Delegate Bennett Parker,
Oh, we're elevating now.
HB 1035.
Thank you, Madam Chair. This bill will allow trained employees of outdoor places to administer EpiPens, just as trained employees of indoor places are currently allowed to administer them. This bill was brought to me by the Arcadia Center for Sustainable Food and Agriculture, which trains veterans how to farm, among other programs. They were interested in stocking EpiPens at their farm and having someone trained to administer it in case a trainee, volunteer, or visitor needed it. Former Delegate Keem passed a bill in 2020 to allow trained employees of public places to administer epinephrine. The employees must be authorized by a prescriber and trained in accordance with policies and guidelines established by the Department of Health. However, the definition of public place came from the Indoor Clean Air Act, which limits the law's applicability to any enclosed indoor place. I've spoken with Delegate Keem and council. As far as anyone knows, the use of that definition and the resulting exclusion of outdoor public places was unintentional. After all, there's things that cause allergic reactions like insect stings outside. Simple common sense bill that will help keep people with allergies safe in both indoor and outdoor places, supported by the Asthma and Allergy Foundation of America and Food Allergy Research and Education. Thank you, Madam Chair.
Thank you so much, Delegate. Are there questions could you explain to us how 10 people voted against this in the House?
I
Did they
don't understand that, Madam
explain?
Chair. I don't know.
Neither do we.
What the opposition could be?
I think perhaps not understanding that the employees have to be authorized and trained in accordance with policies and guidelines established by the Department of Health.
Okay.
Not entirely clear.
Well, we just need to make sure there's nobody here in opposition to this fine bill. Okay, we have a motion and a second. If the clerk would call the roll. Okay, we have a motion and a second.
Senator Pekarsky? Senator Head? Senator Bagby? Senator Pillion? Senator Boysko? Ayes 5, no 0.
Thank you, Madam Chair.
You have HB 964. Please tell us about your
Yes,
bill.
yeah, good morning, Madam Chair. HB 964 amends the current code related to the eligibility requirements for the executive director position with the Board of Medicine to allow attorneys to serve in that role. Currently, Virginia is an outlier. We're the only state in the country that requires a physician to be in that role, and what's happened is the job market has gotten really tough, and the board has had difficulty finding physicians for the position. Yes, in a perfect world, we would have a physician, but it's been really difficult to recruit for that. It's essentially an administrative position, so unlike, let's say, the health commissioner, where you do need a doctor in that position, someone with a medical background at least, this position is really more about process and managing process, and therefore most states have gone to an attorney to manage that, and Department of Health Professions came to me and asked for that flexibility.
Is there anyone here in support of the bill or opposition? So if you just quickly let us know.
Very briefly, Madam Chair, Aaron Barrett on behalf of the Department of Health Professions. We support this bill. We requested it, and we thank the patron for bringing it.
Thank you so much. Is there anyone here in opposition? Seeing none, in a second. We have a motion and a second. If the clerk would call the roll.
Senator Pekarsky? Senator Head? Senator Bagby? Senator Pillion? Senator Boysko? Ayes 5, no 0.
Delegate Willett, we'll see you in the full committee.
Great, thank you, Madam Chair.
Okay, we only have a handful of bills left, and I do not see the patrons here. Sickles, Henson, Rasul. Is there anyone here who might be able?
I think we got Sickles.
Oh, we have Sickles himself. Good. Delegate Sickles,
We've been waiting.
join us. We've been waiting for you. You have HB 329. Tell us about your wonderful bill.
Excited you all are about this, this bill. This is a family and marriage and family therapist endorsement bill, and it uses the Access MFT model to increase the access to quality mental health care providers in Virginia. It will allow marriage and family therapists with an unrestricted license from another state to be eligible for licensure by endorsement in Virginia. This change will remove unnecessary licensing barriers and allow more licensed and qualified individuals the ability to practice in Virginia. Does not alter the scope of practice for marriage and family therapists. And with our mental health issues that we're also familiar with, these therapists often work in that space as well. And I think I have someone that you may know, Madam Chair, here to speak on behalf of the bill. Former colleague of ours.
Well, Delegate, please allow our former colleague to come up and speak on your bill.
Thank you, Madam Chair.
Madam Chair, committee members, wonderful to see you. Really not much to add to this, what Delegate Sickles already mentioned, that this is supported by the Virginia Association of Marriage and Family Therapists and the American Association. I do have someone from the American Association of Marriage and Family Therapists to answer any questions, but it really does reduce barriers. Marriage and family therapists are specialized therapists in family relations and other special training, and we really do need more in Virginia, and this will allow us to bring more in. It's not a compact, so we don't have to agree with what other states are doing. It's not an equal exchange, just to bring unrestricted licenses in. Still goes through the Department of Health Professions, and so they still go through each license as it comes in and make sure that there are no bad apples.
Thank you very much.
Thank you.
Is there anyone in opposition to this bill? Seeing none. All right, we have a motion and a second. If the clerk would call the roll.
Senator Pekarsky? Yes. Senator Head? Yes. Senator Bagby? Yes. Senator Pillion? Yes. Senator Boysko? Yes. Ayes 5, no 0.
Thank you, Delegate Sickles. We'll see you in full committee.
Okay.
Recommending reporting.
Thank
Thanks
you
for your
very
time.
much. You all have a good day.
You have a great day.
Is there
too.
anyone I can go chase down for you now?
We are waiting. We are looking for Rosia Henson also. Delegate Rasul.
Hello, good morning, Madam Chair, members of the subcommittee. I think before you is House Bill 806. 806 that had a Senate companion. I think that there was maybe just some minor differences. Happy to conform and move forward. The issue, just to make sure we're all on the same page, was about trying to have flexibility. A lot of nurses like to have multiple 12-hour shifts instead of 4 10-hour shifts. So this just gives our state facilities that flexibility.
Madam Chair?
Yes, Senator.
Could council tell us what the differences are between the two? Just because I think it's got to be minor, but.
Madam Chair, we are still looking to make sure that there is a cognate to this bill.
So, for my colleagues, Senator Favola had SB 177. It was exactly the same. It went through a different committee, though. It went through general laws. We don't have enough time. It also needs to go to finance. The only difference is that finance added a bit of language. So I would like to see us move this through to the Finance Committee. We didn't have enough time to move it to general laws and then to get it to finance so that it would be processed in time. So
Yes, ma'am.
Madam Chair, I would recommend that we recommend reporting and referring to finance.
All righty, we have a motion and a second. If the clerk would call the roll.
Senator Pekarsky? Yes. Senator Head? Yes. Senator Bagby? Yes. Senator Pillion?
Yes.
Senator Boysko?
Yes.
Ayes 5, no 0.
Thank you. So we will recommend reporting and re-referring in the full committee. And thank you for bringing the bill.
Thank you, Madam
Have a
Chair,
good
members
day.
of the subcommittee.
Delegate Henson, I think this is our final bill. We are really moving through this. If you tell us about your bill, HB 349.
Good morning, Madam Chair, members of the committee. House Bill 349 directs the Board of Nursing to develop a regulatory pathway that expands the role of medication aides to not only administer drugs at assisted living facilities, but also administer drugs at certified nursing facilities. The Board of Nursing would create a work group to determine the educational requirements and criteria to be used to enable medication aides to administer drugs to residents in certified nursing facilities. Madam Chair, I urge the committee to support and report House Bill 349.
Thank you. Is there anyone here in support of the bill? Since we didn't hear this on our side.
Madam Chairman, members of the committee, Scott Johnson, General Counsel for the Virginia Healthcare Association and the Virginia Center for Assisted Living. We requested the bill and ask you to support it. Thank you.
Dana Parsons, Vice President and Legislative Counsel with Leading Age Virginia, and we appreciate the patron bringing this bill and hope that you will support it. Thank you.
Thank you. Is there anyone in opposition to this bill? Seeing none.
I just think it might be interesting for everybody to know. It's interesting to me when this bill was brought to my attention yesterday. In the home care space, home care aides can already do this. Mm-hmm. You just can't do it when you're inside the facility, and that's kind of crazy. So I would move that we recommend reporting the bill.
Right, and a second? We have a motion and a second in front of us. If the clerk would call the roll.
Senator Pekarsky? Yes. Senator Head?
Yes.
Senator Bagby?
Yes.
Senator Pillion?
Yes.
Senator Boysko?
Yes.
Ayes 5, no 0.
Delegate, we will see you in the full committee. Thank you so much.
Thank you so much.
And seeing that there are no other bills, the committee will rise.
The Senate of Virginia, Richmond, Virginia.